Hi, Mrs. Smith. My name's Jeff. I'm going to be your nurse today. I'm going to be inserting a Foley catheter into your bladder. Before we start, though, can I just have you tell me your full name and date of birth, please? Okay, that matches. Thank you. And do you have any allergies, Mrs. Smith? No? Okay. Do you have any pain right now? No? Any questions or concerns? No? Okay. So before we start, I'm just going to set up my work area. So I'm going to do hand hygiene, put on clean gloves, and just wipe down the surface of my work table. Okay, I'm going to let that air dry for 2 minutes. So we'll say it's been 2 minutes and it's air dried, so now I can put all my equipment up on the table. So I have my chucks and a towel and a basin of soap and water. I have extra clean gloves, an alcohol wipe, a sterile 10 milliliter syringe, stat lock, and extra sterile gloves. And then I have my Foley catheter kit. All right, so I'm just gonna pull the curtain closed to give us some privacy. So the procedure today is I'm gonna be doing some cleaning of the perineal area first, and then I'm gonna insert the catheter into your bladder so that it drains the urine. And that's gonna stay in for 1 to 2 days. There might be a little bit of discomfort, but it shouldn't be painful. And you are going to be able to get up and move around with the catheter inserted, so you won't have to stay in bed all day, okay? Any questions or concerns? No? Okay. So I'm just going to pull the blankets down and then lay you down flat on your back. And I'm just going to have you spread your legs. Thank you. Okay, and I'm gonna put the chucks down like that. Okay, so I'm just gonna do hand hygiene, put clean gloves on, and then put the basin of soap and water down. I'll take my towel and I'm just gonna wipe the perineal area, and I'm gonna use a new corner of the towel each time and wipe from front to back. All right, so go right side, left side, the inside right, inside left, and then one wipe down the middle. All right. Doing okay, Mrs. Smith? Yeah, no pain? Okay, good. All right, so I take these gloves off, do hand hygiene, and I'm just gonna pull your blankets back up while I set up the Foley kit. Okay, keep you nice and warm. All right, so now I can open up my Foley kit. So I'll just do hand hygiene again. And pull out the kit. Okay, I'm gonna use this bag as a trash bag when I'm doing cleaning. All right. So open up the kit. And take out sterile gloves and the bed protector, and I'll take out the urine sample cup, and then I'm going to take my sterile 10 milliliter syringe, open it up and drop it into the kit. Okay. All right, so I'm going to take your bed sheet down again. Okay, and I'm gonna put the bed protector on top of the chucks with the shiny side down. Okay, and now I can put on my sterile gloves. So I'll just move this back a little first. I'll do hand hygiene. Okay, put these on. All right, so put this one on first. And then this one. Alright, and then I'll throw away the packaging. Alright, so now I can take off the tray, the top of the tray, and I'm gonna attach the water-filled syringe onto the green port of the catheter. There we go. And then I'm going to take the outer tubing off the tip of the catheter. Okay, toss that. And take the plunger out of the lubricant filled syringe. Okay, and then put the tip of the catheter into the lubricant. All right. Okay, so now I can take down my supplies down here. All right, so I'm just gonna do some urethral cleaning now, Mrs. Smith, all right? So I'm gonna take the iodine solution, tear it open, and pour it over the cotton balls. And then I'm gonna use the forceps to pick up each cotton ball and wipe the area. So with my left hand, I'm just gonna spread the labia and hold it there. And I'm gonna wipe down all around. And I'm gonna be wiping front to back and from outside to in. So inside, and then down the middle. Okay, doing okay, Mrs. Smith? Okay, good. All right, so now I'm just gonna move this back here. And I'm gonna insert the catheter now, okay, Mrs. Smith? So I'm gonna go gently and slowly. All right, so on the count of 3, okay? 1, 2, 3, insert. And I'll insert until I see urine return through the catheter, which I see now. So then I'm gonna insert a further 2 inches into the bladder. All right, then my left hand, I'm gonna push the water into the balloon at the tip of the catheter. And then disconnect. And then with my right hand, I'm just gonna tug back gently on the catheter to make sure that the balloon is in place in the bladder, which it is. All right. That's good. Okay, so are you doing okay, Mrs. Smith? That didn't hurt at all? Okay, good. All right, so now I'm gonna take a urine sample. So I'm gonna first kink the tubing below the port. and then get my sterile 10 milliliter syringe. First, actually, though, I'm gonna get my alcohol wipe and wipe down the port for the urine. Okay, I'll wipe down the blue port with the alcohol wipe. Okay. And then take my syringe, push that on, then withdraw at least 5 milliliters of urine. Okay, that looks good. Take that off, and then I'm gonna push it into the specimen cup. Careful not to spill any. All right, I'll put the lid on and write the patient's name, their medical record number, and the date and time. And I'm going to take this with me to the lab when I leave. Okay, still doing okay, Mrs. Smith? All right, good. So I'll unkink the tubing now. And I'll get the stat lock. Okay. And I'll clip the tubing into the stat lock. All right, clipped on. I'll take the adhesive off. All right, and then I'm gonna stick the stat lock on the top of the thigh, right about here. Okay. Make sure the tubing is secured. Okay, and then I'll take the rest of the tubing and just attach, or just clip the extra tubing to the bed sheets. Like that. And then hang the collection bag at the side of the bed below the level of the bladder so that gravity helps drain urine into the collection bag. All right, you doing okay, Mrs. Smith? All right, good. So I'm just gonna clean up some of this supplies that I'm done with. Okay, I can take the chucks. And I'll just clean up my table as well. And this. Okay, I'll take these off. Do hand hygiene. Okay, so I'll just put you back in a comfortable position. So close your legs and sit you back upright. And I'll put your blanket back on. So do you have any questions or concerns for me before I go, Mrs. Smith? No? Okay, well, I'll see you later then, all right? Okay, so I'll take my supplies, extra supplies, and the urine specimen, and I'll document the date and time, the patient's tolerance to the procedure, the color consistency and amount of the urine that I saw, and the size of the catheter that I inserted. Okay, so now I'll just set up for the removal. Okay, so we'll say it's been 2 days and there's an order now to remove the Foley catheter. So that's what we're gonna do. All right, so knock knock. Hi, Mrs. Smith. My name's Jeff. I'm going to be your nurse today. Before we start, can I just check your ID band and can you tell me your full name and date of birth, please? Okay, that all matches. Do you have any allergies, Mrs. Smith? No? All right. Are you in any pain right now? No? Any questions or concerns before I remove the catheter? No? All right. So, my supplies here. I've got my chucks, sterile 10 milliliter syringe, and a bunch of clean gloves. So before we start, I'm just gonna close the curtains around us and explain the procedure. So I'm gonna be removing the catheter from your bladder and see if you're able to urinate on your own now. And then I'm gonna measure the amount of urine in the collection bag, all right? Any questions? No? All right. So first thing, I'm going to do hand hygiene. Put clean gloves on. And I'm going to pull your blankets down and lay you flat on your back, and then have you open your legs up for me. Thank you. All right, so now I'll put my chucks down. Okay, take these gloves off. Do hand hygiene. And put new clean gloves on. Okay. So first thing I'm going to do is open up my syringe, and I'm going to remove the water from the balloon. So I'll attach the syringe, and then I'm just going to draw the water out of the balloon. Make sure I get as much out as possible. All right, that looks good. So I'll detach that. And now I'm ready to remove the catheter. So as I pull the catheter out, Miss Smith, I'm just gonna have you take a deep breath and then exhale as I'm pulling the catheter out, okay? All right, are you ready? On the count of 3, okay? So 1, 2, 3, exhale. All right, that came out easily. So I'll put the tip in the chucks, and then I'm gonna fold the chucks up and leave it there. So are you doing okay? Any pain when I was pulling that out? No? All right. So I didn't feel any resistance as I was pulling that out, so that's a good sign. But if I did feel resistance, I would stop and get the syringe again and make sure I pulled all the water out, and then try again pulling the catheter out. If I still felt resistance, then I would stop and call the doctor and let them know. All right, so now I can I'll take the stat lock off of the top of Mrs. Smith's thigh. All right. Okay, so that's off. And I'll unclip from the bed. And then I'll pick up the collection bag. All right, so I'm gonna take this to the bathroom and pour it into a graduated cylinder, which I have here. And so I'll pour it in, and then I'm gonna measure the clarity, color, and amount of urine from the bag. Okay, got that noted. And then I can pour it in the toilet, flush it, and then I can throw the catheter and collection bag away as well. All right, so I'll remove these gloves, do hand hygiene, All right, doing okay still, Mrs. Smith? Good, so I can put you back in a comfortable position now. Close your legs, sit you back up, and put your blankets on, keep you warm, comfy. All right, so just a little bit of teaching after removing the catheter. I'm going to measure the amount of urine that you pee out the next few times you go pee, and there might be some burning the next one to two times you go pee, so that's normal, but it should start to go away after a few times you go pee, okay? And let me know if there's any blood in the urine, or if you have any trouble going to the bathroom, or if there's increasing pain as you need to go pee. All right? Any questions? No? Okay, I'll see you later, okay, Mrs. Smith? So I'll take my items and then I'll document the date and time of the procedure, the patient's tolerance to the procedure, and the color, consistency, and amount of urine in the bag and in the next 1 to 2 times that she goes pee.